Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
The ability for pharmacists to deliver and provide vaccines is important. It's much easier to go to a pharmacy. Oftentimes you don't need an appointment. It's not as scary, for anything else as going to a doctor's office. It's not as intimidating. And now they're also able to provide COVID vaccines. And in some jurisdictions, they're even able to provide routine immunizations as well. So that definitely helps. Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
So, Steven, today we're going to talk about vaccines, where we stand with COVID vaccination rates, new vaccines on the horizon, and just vaccine strategy overall in the United States.
Great. Well, let's start with the COVID bivalent booster.
Okay, so, thinking about when this was first authorized and available to us, that was around the end of August of 2022. It got the emergency use authorization and it became available in September, both the Pfizer and Moderna formulations for adults in the US. Is that right?
That's correct. In early October 2022, it was authorized for kids 5 to 17, depending on the vaccine. Pfizer is 5 to 11 and Moderna is 6 through 17. And in early December, the emergency use authorization was updated to include children as young as 6 months and older.
So from August to December, all the groups got availability to this new booster. And where do we stand now is the big question. What are vaccine rates if every U.S. citizen is eligible for this vaccine?
Well, as of today, only 15.3% of Americans have gotten an updated booster. That's pretty low.
Wow.
15.3%. I'll say it again, yeah.
That's really shocking, actually. I expected it to be a bit higher.
I know, particularly with all of the announcements that you see about the importance of getting vaccinated in winter season, leading up to winter season in November and December. There were so many announcements, get vaccinated. It's still relatively easy to find a vaccination site. It's still free. So it is definitely surprising, to say the least. There's no doubt that it is the easiest way to protect yourself is by getting the updated bivalent booster. But here we are, 15.3% of us have gotten it.
So why is it so low, I guess, is the biggest question. And I found a study online that could help us understand this low rate of the bivalent booster compared to the other COVID vaccines. So this was published by the Centers for Disease Control and Prevention in their MMWR, so Morbidity and Mortality weekly report. And it was about reasons for receiving or not receiving the booster. And what's interesting is that all of the respondents of the survey had at least 2 doses of the COVID vaccine. So we're not talking about a group that was against the vaccine. These are people that got their primary series. Okay, so Steven, the study found that the common reasons for not getting a bivalent booster were, number 1, lack of awareness about eligibility or vaccine availability, and then also overestimations of their own existing immunity, whether, it be from previous vaccines or infections. And I thought that was really interesting.
That is really interesting. I mean, I sort of can understand the second one, the idea of overestimating your own immunity. Yeah, I'm fine. I'll be okay. I don't need this. But the lack of awareness about eligibility or vaccine availability is so high, it boggles my mind. And I guess it sort of shows that we live in a little bit of a bubble because to my mind, I see notices everywhere. They find me every time I go online. Those are the pop-up ads about getting boosted. And, the idea that people still don't know that is very surprising.
I went home to New York, New Jersey a few weeks ago, and I did notice a lot more signage about COVID compared to here in Nashville. There's really nothing. If you go into a pharmacy, of course, there's a sign about shots available here, but it's not broadcasted. Like we don't have a subway system, for example, and that's where a lot of signs are in New York. And it was like coming home and feeling comforted. Oh yeah, here's my bubble. Here's my people with my messaging. But I guess it's hard to understand that people don't know, but I also understand at the same time because I see that we're not getting the right messaging out in other parts of the country.
Yeah, so it's interesting. I'm going to assume that that study did not break it down by geographical region.
I don't know.
Okay, well, fair enough. We certainly don't have the data for geographic region. But beyond that, what are the thoughts? What thoughts do you have, if I may ask, Zoe? Putting you on the spot, what thoughts do you have for better educating folks about the availability of these vaccines? The fact that number one, they are available. Number two, you are eligible if you have not gotten a fourth dose. That means you.
Yeah, I think it's about meeting people where they are.
Right.
So, what are people doing every day? They're going to the grocery store, they're dropping their kids off at school, like just so they're carpooling, they're driving on highways, maybe signage there. I think that we have to consider where we're putting messages, that we're meeting people in their everyday life and not creating an extra burden, because often like healthcare can feel like a burden, especially for people with chronic illness. But I think it's just about getting the right messaging out in the right places. And interestingly enough, this survey found that for participants that were given more information on eligibility and availability, 67.8% of those that hadn't gotten their boosters said they would get one. And then a survey 1 month later showed that 28.6% had actually done so. So, giving information works.
Yeah, absolutely. I totally agree with that. I guess, like you said, it's meeting people where they are. I mean, there was a time when you couldn't walk 3 blocks in a major city without seeing a vaccine. Now, to some extent, you have to seek it out a little bit more affirmatively now by going to a pharmacy. Without diving deep into these numbers, I'm less concerned about chronically ill folks who probably have the right information, at least when it comes to knowing the availability of the vaccines, and more concerned about the general public. I'm hoping that the chronically ill community is aware of what's available and their eligibility. But of course, it is important for chronically ill individuals that a large swath of the population also gets vaccinated to help control the virus and the spread of the virus.
Exactly. I mean, we can dive so deep on that, on the concept of herd immunity. Yeah, we thought we could get there with COVID, but haven't. But it still does matter that those around you are vaccinated. And then, Steven, just really quickly, something else that helps with vaccination rates is pharmacists' ability to give vaccines. And I wanted to give a shout out to our colleagues, Connor and Robert, on Healthcare Matters. They recently did an episode on this topic on a report looking at the pharmacist's role in immunization. And overall, they found that since the pandemic, adult patients were getting vaccines at pharmacies and just general vaccines, and how important of an access point this is.
Yeah, absolutely. The ability for pharmacists to deliver and provide vaccines is important. As you said, it's much easier to go to a pharmacy. Oftentimes you don't need an appointment. You can just walk in. It takes a few minutes. It's not as scary, for anything else as going to a doctor's office. It's not as intimidating. And it's been many years throughout the country where pharmacists have been able to provide flu vaccines. And in the United States now, they're also able to provide COVID vaccines, of course. And in some jurisdictions, they're even able to provide routine immunizations as well. So that definitely helps.
Thinking about the COVID vaccines and the low rate, experts are looking in strategy going forward about vaccine timelines. And our recording is before this meeting, but the FDA is considering a shift in the COVID strategy because currently I actually just learned this. So currently people want to get fully vaccinated against COVID. You have to first get your primary vaccines. So those first 2 shots spaced weeks apart, and then 2 months later, you're eligible for the booster. So you can't just walk into a pharmacy and say, I want the COVID booster if you haven't got the original series, which has a bit of a disadvantage because that's updated to combat the current variant. So now the FDA is gathering to discuss whether or not it should just be similar to an annual flu shot where you don't have to have this previous injections in order to be eligible for the current shot.
Right. So that would obviously be a big help. So we'll see what happens with that.
So, what does that mean for immunocompromised? Well, there aren't guidelines yet. This is just initial thoughts in a meeting. It says that the FDA would recommend 2 annual doses of the shot. And I was just thinking how it's kind of annoying for people with chronic illness to have to do 2 shots because, myself, like many, had to hold my regular injections that treat my arthritis and Crohn's for the COVID shot. shot. So, doing that twice is like a huge setback in health. And
Yeah.
I know for the flu shot, I get a higher dose with my rheumatologist. And I guess, if anyone's listening from the FDA, we would like a higher dose so we don't have to go in twice and skip our meds twice, because it's just, a lot of considerations on your body.
That's true. I'm just thinking out loud. I do wonder if some of that happens to be because having 2 doses is more effective than getting 1 stronger dose. I don't know the answer to that, but I'm just positing that as a potential, as well as the side effects of a much stronger dose of COVID vaccine versus a stronger dose of flu vaccine could be more impactful, shall we say, in the 24 hours after receiving it. Just a guess or just a potential answer. But yes, obviously getting 1 vaccine is better than getting 2. It's simpler.
Yeah. So, we'll wait to hear the guidance. That's all really good points. And obviously, I just want to do what's best and going to be the most helpful. But it's just a bunch of considerations. Other things experts are grappling with as this meeting comes up. Is it too soon to rely on annual boosters? Is targeting new variants the most effective way to combat COVID? A bunch of questions like that.
Yeah. So we'll see what the FDA does and we'll see where we go from there. And we'll report what we learn as always.
So, we covered COVID and flu. Now let's turn to the third link in our triple-demic, RSV.
Well, yeah, there's no vaccine to prevent RSV. There is a medication that can help protect some babies that are at high risk for severe RSV disease. It's very costly and it requires a monthly injection, but there is another medicine in development for infants that would last for an entire season.
That's great to hear that there's something in development. And I think there's also a bunch of vaccines in development for RSV in both elderly and infant populations.
And Moderna and Pfizer, as we know, produced the COVID vaccine in record times, shaving years off the traditional vaccine research and approval process. And now the same expedited timeline is occurring for RSV in both elderly and infant populations.
So the vaccines, I know for infants, it's focused on pregnant women to protect their infants by transferring antibodies in utero, which is pretty cool. Actually, one of my friends got the COVID vaccine in, I think, the 3rd trimester, and her baby was born with protections against COVID. So, it's just really cool that we're able to do that.
Yeah, absolutely. So we'll see what happens. Hopefully we'll get some development on this, particularly for the elderly population and those with young children.
And I haven't seen any talk about a vaccine for RSV for immunocompromised, but we could probably expect that next, right? Since they're focused on high-risk groups. So we'll definitely keep our community updated.
For sure.
All right, Steven, that brings us to the close of our show. What did you learn today?
Well, I was definitely surprised when you told me that the top reasons for folks not getting their bivalent boosters is because they're not aware that they're eligible, number one, and number two, that they're just not aware about the vaccine generally. It was just surprising. I can't believe with all of the information that's out there, it just goes to show you how difficult it is to break through with important information.
For me too, I was so shocked by that 15% have gotten the bivalent booster, especially because it came before the holidays. I really expected that number to be higher.
Well, we hope that you learned something too. And before we go, we definitely want to give a shout out to Healthcare Matters, where our colleagues Conner and Robert recently did a deep dive episode into the report on pharmacists' role in immunization that we spoke about earlier. You can check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating and write a review on Apple Podcasts, and check us out on YouTube. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.